After you finish going over with the patient the chiropractic and PT part of the care plan, you're going to move right into the review of modalities and products. For example, if a patient is prescribed spinal disc decompression, you'll say, Dr. Harold has prescribed spinal disc decompression to benefit your low back pain. You're going to take out the brochure and you're going to show them what decompression looks like. You're going to say, spinal disc decompression looks like this. You're going to say, we use Triton DTS technology here at MSI, and during decompression therapy, don't just say decompression, say decompression therapy, the doctor will program the motherboard according to your diagnosis, and the table will administer the traction to your low back in a gentle and effective way. This will help your disc heal quicker and is FDA approved for non-invasive pain relief. Okay, so if you can remember to hit those pieces, it will add value. Remember, we're building value for the patient. The patient is going to be paying for these services to help themselves get better with their time. They're paying with their time, they're paying with their finances. And so at every angle, we want to show them how valuable this care is because they haven't experienced it yet. And so everything that you say matters. You're going to move along down the care plan and share the rest of the products. I'll review one product with you, okay? Let's say the back brace for the low back has been prescribed. You'll say this, Dr. Harold has prescribed a few important care plan products for at-home use while you're in active care, and they can also be used into your maintenance care, all right? So show excitement about these things that you're sharing with the patient. You will want to pull on your personal experience as a patient, right? So for me, I'm thinking of the fact that I do have a back brace at home that I use for my maintenance care. I use it when I know that I'm going to be overusing my low back. For example, when I'm gardening in the spring. So I can relate to the patient in that instance, and your nonverbals, your attitude, your facial expressions should show that as well. With the back brace, you always want to point out with the back brace, with the knee brace, with orthotics, you want to point out that we are going to do a formal fitting with the patient. So you'll say this after you describe the back brace. So you'll say, I'll back up a little bit. You'll say, Dr. Harold has prescribed a back brace to offer stabilization and support for your low back. This is a prescription brace based on your diagnosis and, as a rule of thumb, should be worn during your most active times of day. And you want to take that brace out of the package, move it around, show them how agile it is and how it can be modified for their lifestyle. And if you have a personal story about your product, your back brace, share that story if you feel it's appropriate with the patient. And then you'll say this to the patient. After purchasing your brace, you'll have a formal fitting with us to learn how to properly wear your brace during the day. Do you have any questions?